Hey there, I'm Taylor. Ever since I was a kid, and as early as I can remember, music has been a major part of my life. Whether it was hearing my mom sing and play her guitar, jamming to a favorite song in the car, or blaring my lungs out in the shower, where we all sound best, it has always brought joy to my life. Music is a powerful tool. It defines cultures, creates memories, establishes milestones, even has the power of healing. It has the ability to transcend places of sorrow into beauty. There's something magical about the harmonies, rhythms, and strums that can take you places. If you traveled around the world, every region might have their own style, whether it was the sounds of bagpipes in Scotland, pounds of tribal drums in Africa, or jazzy saxophones in New Orleans. Every place has their own taste to define their culture. There is a universal appeal to music where everyone finds joy and pleasure in the sounds of voices and instruments to create music. As medicine continues to modernize over each century, health professionals have sought after new therapies to aid in the healing and treatment of medical disorders. Over the past couple of decades, a new therapy known as music therapy has become a thriving remedy to help heal and calm the sick in conjunction with medicine. Music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. It addresses the physical, emotional, cognitive, and social needs of individuals by creating, singing, moving, or listening to music. It can also provide an avenue of communication to those who may have difficulty expressing words. References of using music therapeutically can date back to the 1700s, but didn't get its big break until the 1900s during World Wars I and II. Professional musicians from around the world came to comfort the needs of veterans suffering from physical and emotional trauma, and after doctors and nurses noticed the soldiers' responses, they started hiring musicians to come play frequently. As time has passed, music therapists have entered healthcare facilities, even home, providing their musical talents to the needs of patients. Music therapy covers all age groups over healthcare. You might find one playing the guitar calming a cancer patient's spirits before and during a chemo treatment, or at a child's bedside preparing them for upcoming surgery. The family of a hospice patient laying in bed at their last hours may have a therapist come in to make this process a smoother transition. A patient who recently underwent surgery for a hip fracture and is in a rehabilitation facility regaining her mobility may have a therapist there to provide some musical beats and rhythms, enhancing that process. This natural form of therapy is beginning to inch its way into more and more avenues of healthcare in conjunction with traditional medical treatment. Many will attest to the fact that music has a calming effect during anxious times or brings happiness through a favorite song. Music actually has a scientific explanation to its phenomenal powers in healing and treating the sick by naturally enhancing bodily functions. A neurotransmitter known as dopamine is a chemical associated with pleasure. If we tasted some of our favorite foods, a surge of dopamine may be released into the nervous system, giving us a natural euphoric effect. When we hear music, a favorite sound or melody, a surge of dopamine is released from the brain, giving our bodies a natural feeling of calmness and relaxation. Music not only affects the auditory lobe of the brain, but every lobe of the brain, enhancing speech, touch, movement, and emotion. Music works almost naturally without the common side effects from pills and medication. While music therapy sessions may be different in each setting, they all have the main goal of reaching whatever the patient may need at the moment in time. Typically, the therapist will come with an instrument and play songs to relax the patient, bringing back memories to recollect on, or have the patient play along for interaction. BJC Hospice out of St. Louis, Missouri offers music therapy to clients during their times of need. Their music therapist gives an overview of what she does at the bedside in a hospice home setting.
In a session, and it depends on the patient and the need and the interest, but most of the music that we do is live music, so I will be playing the guitar or another instrument, and I do songs that are significant for them, songs that are important from their life, be it maybe a love song or songs that remind them of events of their lives, a lot of spiritual music, things like that. So I will sing and play, and oftentimes the patient will sing, the family will sing, or they will choose songs that are significant, and the family may be near and in the room with us, and we're singing. And the first thing that happens with that is if a patient's having pain or anxiety, just starting to hear music that they enjoy takes their mind off of what's going on with their body. So it starts as a distraction. And then from there, the music starts to work to calm and relax and bring comfort for the patients. So yes, I'm playing and singing. Sometimes they're singing. Sometimes I do instrumental music with them. I may do a relaxation session with them with guided imagery and relaxation. In that case, I'll use recorded music and talk them through relaxation. I always make an assessment before and after my visit. I want to see what their pain level is, their anxiety level, and just how they're feeling emotionally, so that I can tell before and after if there's been a shift. And almost always they tell me their pain is down. They're relaxed. They're uplifted. To my knowledge, no other hospices in this area have music therapy services provided. To be able to bring comfort to that patient and that family, to be able to bring joy, it's just the most blessed work of my life. It's the highest calling. I mean, I couldn't imagine ever wanting to do anything else.
Multiple research studies have been done showing the positive outcomes of music therapy in a clinical setting. One study reviewed the use of using lullabies and in utero sounds for babies who were placed in a NICU setting. When the neonates were exposed to the sounds, vitals improved, sucking reflexes improved, and parents had less stress during bonding periods. Studies on using music therapy for clients suffering with depression showed positive improvement in conjunction with typical antidepressant medication. Studies also with Alzheimer's patients using music therapy showed improvement in mood, as music brought memories of favorite songs and special milestones, while upbeat songs promoted movement and interaction. Music can work just as medication does in the body. If we compared music to medicine, music works as pain relievers, anti-anxiety aids, mood stabilizers, and even improves mobility. Studies have been performed and endorsed by the American Cancer Society revealing that music improved pain associated with cancer, helped relieve nausea and vomiting associated with chemotherapy, and calmed patients' anxieties regarding chemo and radiation treatments. Music has relaxed patients prior to upcoming procedures, calmed nerves during stressful situations. In rehab facilities, music has enhanced movement, allowing patients to gain their strength back and improve their mobility. Music has helped children with autism gain social engagement and interaction. This musical medication also allows the body to naturally care for itself and does not have the associated side effects as normal medication would have. While music therapists are the main facilitators in music therapy, nurses can play an important role as well. They can be a part of the interdisciplinary team that initiates plans of care and incorporates music therapy when needed. Nurses can be advocates for the therapy, suggesting to patients, or recognizing the need for it when the patient may be in distress. While medication has proven to have great outcomes for patients' needs, having alternative therapies available for patients such as music therapy can make transitions in and out of health situations less stressful and make medical situations a little more enjoyable. Bringing the comfort of everyday living, such as listening to a favorite music, into the healthcare setting could be a melodic rescue for a patient. After all, if creating comfort for a patient in a clinical setting is a primary goal for many facilities, why not enhance that process with the power of music? Not only does it fill the somber room full of happiness, but it's making its way to becoming a new form of natural medicine. I personally hope to see it more available in facilities to bring more comfort, relaxation, and joy to people in times of need. Music moves people, stirs up emotion, and marks memories for a lifetime. Let's bring joy to these people with the sound of music. Let's make music, folks. Let's make music.